So thank you so much for joining us today. The webinar is Sticking With It, Engaging Men and Boys in Family Planning Across the Life Course. This webinar is brought to you today by Breakthrough Action, led by the Johns Hopkins Center for Communication Programs. Next slide, please. My name is Danette Wilkins. I use she, they pronouns, and I'm a program officer for family planning with Breakthrough Action. And in today's webinar, we will be examining good, promising, and emerging practices for engaging men and boys in family planning. We will also be considering opportunities and challenges in engaging men and boys in family planning in different life stages and relevant socio-contextual factors. And we'll also be exploring programmatic implications for designing interventions that improve outcomes and reduce disparities around family planning across the life course. Next slide, please. Before turning over to our moderator, I'd like to share some background for today's webinar. The Male Engagement Task Force with the U.S. Agency for International Development, or USAID, is an information and knowledge exchange network on what it means to engage men and boys in health promotion and gender equality. In the last year, the Male Engagement Task Force, which falls under the Interagency Gender Working Group, published the Do's and Don'ts for Engaging Men and Boys, which is a 2-page guide that brings together recent best practices and lessons learned on how to meaningfully engage men and boys as consumers of health services, supportive partners, and agents of change. The guide is meant to inform decision-making about programming, policy, media coverage, research, and funding priorities. The intended audience includes implementers, researchers, and donors. It is currently available in English, French, Portuguese, and Spanish, and the link will be posted in the chat box shortly. Please feel free to share this resource with your networks. Next slide, please. Growing evidence shows that meaningful engagement with men and boys in health promotion and gender equality can result in positive changes in attitudes and behaviors that not only support them in improving their own health outcomes, but also benefit the health and well-being of others. Despite ongoing efforts to engage men and boys across health areas, there's still more to be done to coordinate and prioritize meaningful engagement in family planning. Unfortunately, this has resulted in missed opportunities to promote gender equality and improve family planning outcomes for men, their partners, their families, and their communities. Next slide, please. I will now turn over to our moderator for this webinar, Brian Heiman, a senior research officer with Promundo, a global leader in promoting gender justice and preventing violence by engaging men and boys in partnership with women and girls and people with other gender identities. Brian, over to you to introduce today's webinar. Next slide, please.
Yeah, thank you so much, Danette. On behalf of Promundo, I do really appreciate the opportunity to help guide this conversation today, even though I'm really going to try to keep the focus squarely on our 4 excellent presentations. For those who aren't familiar with Promundo, the organization I represent, we are a nonprofit originally founded in Rio de Janeiro in Brazil, working to promote gender equality and prevent violence by engaging men and boys in partnership with women, girls, and people of all gender identities, like Danette said. This includes research, such as the International Men and Gender Equality Survey, or IMAGES, which has now been undertaken in over 40 countries. Also, some of you might be familiar with our State of the World's Fathers series of reports, among others. And then we use research like that to help craft gender transformative programming, including curricula and group sessions for youth and really men, women, and members of all gender identities, as well as parents. And these programs always do address the linkages between harmful norms and ideas about masculinity and the topic we're concerned about today, family planning and sexual and reproductive health. I'm proud that everything Promundo produces, including these reports I'm mentioning and the curricula and guides, are all available for free on our website. And I think Danette will place the link in the chat right now. That's promundoglobal.org. So just to re-emphasize what Danette shared, we really want to keep the focus in the webinar today on 2 things, really. We want to explore, what does a life course analysis really tell us about engaging men and boys in family planning? And I know that especially our first presenter is going to go deep on what that analysis looks like. And then we also want to bring these lessons around into practical guidance that kind of follow that mold of the do's and don'ts document. Very simple guidance that all of us here can take and put into our work. So the various presenters know this, and I expect throughout their presentations and then at the Q&A at the end, we'll just make sure that we're giving you all very concrete guidance based on the life course analysis, but that speaks to, the guidance of the sort that fits within the do's and don'ts document. So I just want to introduce our presenters. You can see their names on the screen. First up, we're going to hear from Jeff Edmeades, founder of the independent consulting firm Demografix, along with Kerry MacQuarrie, a senior manager for analysis and research with the Demographic and Health Surveys program at Avenir Health. They are going to provide an overview of life course theory and its implications for engaging men and boys in family planning. They will also present major findings and key takeaways from a recent study coming from the Demographic and Health Surveys program on the key family formation events that occur over the life course. After Jeff and Kerry, we're going to hear from Alice Molinier, engagement manager with Breakthrough Action at the Camber Collective, who's going to use research conducted in Niger to highlight the importance of adopting gender-synchronized approaches in family planning, and also highlight some key recommendations for donors, policymakers, and program implementers. After Alice, we're going to hear from Bethany Arnold, who is a technical advisor with Jhpiego. Bethany is going to share how the Maternal and Child Survival Project implemented couple communication activities in Togo aimed at promoting male engagement in family planning and access to voluntary family planning. And then our final presenter of the day will be Ruchita Pillai, who is a monitoring and evaluation advisor at the Johns Hopkins Center for Communication Programs. Ruchita is going to share how the Breakthrough Action Zambia project developed and implemented integrated health innovations within a larger umbrella family health campaign in order to mitigate some barriers preventing adolescents and men from engaging in and maintaining healthy behaviors. We are going to need to move quickly so that we have good Q&A time at the end, but we really hope to have that time. Please do add your questions throughout into the chat box. But without further ado, I think it's time to get into the presentation. So if we move ahead in the slides, and over to you, Jeff and Kerry. Thanks so much.
I think, thank you very much, Brian, and thank you everyone who's here. I don't think we need to spend too much time on these slides with Kerry and myself. They'll be available afterwards for folks to see who we are. Obviously, today, Kerry and I will be presenting on the relationship between key family formation events over the life course. Next slide, please. We'll begin with a very short, lightning fast introduction to life course theory. So life course theory, the benefit of life course theory, the strength of the approach, is that it provides a singular conceptual framework for understanding why people behave in particular ways, how this changes over time, and what the influence of context is on behavior. And one can appreciate the benefits of this approach because after it's explained, it seems very obvious, but it is one way of bringing all this together. So one definition that I particularly like of the life course is a record of age-related transitions that are socially created, socially recognized, and socially shared with the intentional emphasis on the socially component, as you'll see through the presentation. Some key concepts that I would like you to come away from today is first, that individuals are influenced both by the context that they lived in the past and the current context that they live in now. Context at specific points in the life are more important than others. For example, attitudes and norms around gender roles during childhood and adolescence are especially important. Life course theory also sees the life course as a series of ordered life course stages which are socially defined. They are periods of life with specific social expectations for behavior that distinguish them from other stages. We'll see a visualization of this in a couple slides. The beginning and end of life course stages are termed transition points. They're markers of moving from one stage to another, such as moving out of your parents' home or starting your own family. Sometimes they may be a singular event, but typically they're a group of events together that mark your ability to move into a different socially accepted stage of life. While this may seem very orderly, there are things that can upset this and send people on different life trajectories. Big events or opportunities such as an unanticipated scholarship or an economic crisis can turn your life course in a different direction in ways that have long-term implications. The social expectations for the ordering, timing, and sequencing of life course stages together form a social timetable, which people can use, or societies and groups use, as guidelines for what is expected in terms of the ordering and timing of different events and life course stages. This is tied to chronological age, but mainly socially defined. So this tells you when you're moving from one stage, such as adolescence, to adulthood, and what that actually means. There are expectations of being on time or off time in terms of the social timetable are important. So these social expectations shape the boundaries of how most people live their lives in certain societies or groups. You could think of these as pathways with edges that keep people within the boundaries of social expectations. It doesn't mean that people can't take their own path, just that it is shaped by these expectations. Next slide, please. So what is different about men's life courses? So men and women's life courses share a lot of common factors, but are not the same. And the key differentiating factor between the male life course and the female life course is our gender norms, the gender norms that define what it means to be socially a man or socially a woman. And those expectations mean that life course stages and the expectations for behavior within them are different for men and women, with men facing particular pressures to perform certain roles associated with masculinity, such as being the financial provider for the family, or being the leader of the family, and so on. Failing to meet these expectations are a really big problem because they can interrupt progression between life course stages, and also because they implicitly threaten an individual's status as a man in society. So they have both a practical life course implication, but also this concept of your status and your ability to be a man. So for example, failing to meet the standards for transitioning to adulthood have some really practical implications, both for your ability to move forward socially, but then also your self-identity as a man due to these norms of masculinity. Next slide, please. So what might this look like? If you think of our life course stages, here this divides life course stages into infancy and childhood, early and later adolescence, early, middle, and later adulthood. And one could see this idea that this life course exists within a social and economic context, as well as being tied to chronological age and social time. This looks very orderly, but it is important to understand that each of these are socially defined and are not the same in each place. Some places view, say, youth as a much wider range in terms of chronological age than others. And that is an important social distinction that programmers have to take into consideration. So overall, I would say it's important to note what men need and want is not static across time and across their lives, and programming should not assume that it is, and hopefully none of the programs that we're involved in actually approach it that way. But social expectations at different life course stages have implications for family planning and sexual and reproductive health. For example, boys during adolescence are often expected to be proving their sexuality through sexual activity, while in early adulthood and middle adulthood, men are facing different pressures around having children, limiting children, providing for their family. It is important to think of needs at each point, how these are linked together over time, and how these are socially constructed. So I'll pass it over to Kerry to give some examples from recent work that we've done together that have focused on the family formation process in particular and linking this to the life course. So next slide, please. Kerry, over to you.
So with that conceptual background in mind, we embarked on an empirical study to describe what the social timetable was around this transition from later adolescence into early adulthood, using DHS data in 8 countries in West and East Africa and South Asia. And we are in this study particularly looking at family formation events, the timing of those events. And we picked a bundle of 3 key events: the timing of first sex, of first marriage, and the birth of first child. And the information from this study is released in a DHS report and a research brief on the DHS program website. So next slide, please. So what I'm presenting here is descriptive data from all 8 study countries showing the median ages at these key events. We've got age on the vertical axis on the left-hand side, and working from the bottom of the chart up, we have timing of first sex in the orange ovals, followed by first marriage in blue triangles, and then finally the green boxes with the age at birth of the first child for men. Next slide, please. What we found were 3 distinct typologies of the timing of family formation across the study countries, and these aligned roughly with region. So the first type that we found is evident in West Africa and also in Uganda. And this is a pattern in which the progression through these family formation events takes a relatively long period of time, a little bit over 6 years on average. And it's marked by a fairly long gap between the median age of first sex and first marriage, followed by a shorter gap between first marriage and birth of the first child. In this situation, in this pattern, we also found that premarital sex as well as premarital childbearing are relatively common. Next, please. The second type that we discover is evident in the 2 remaining East African countries, and it's a more moderately long progression through family formation events, with the events being fairly evenly paced. So there's a moderate gap between the median age of first sex and first marriage, followed by a shorter to moderate gap between marriage and first birth. And in this typology, we also find that premarital sex is quite common. However, premarital childbearing is less common. Next slide, please. The final typology appears in our 2 South Asian study countries, and this one has the shortest overall progression through these family formation events, spanning about 3 years on average. It's marked by a fairly short gap between the timing of first sex and first marriage, and in fact, in India, you can see that these events are almost one on top of the other. But this is followed by a somewhat longer gap between the time of first marriage and the birth of the first child. And in contrast to the other typologies that we found, premarital sex as well as premarital childbearing is quite rare. So having looked at what the normative behavior is in terms of the timing of these events, we next wanted to explore the extent to which men actually follow this particular timetable and the extent to which how they might deviate from it. Next slide, please. So what I am presenting here is a Sankey diagram for one country, Nepal. And this shows, a Sankey diagram is a type of a flow diagram that shows the possible trajectories that men can take through each of these transition points. And in which the flows, that is the horizontal ribbons that you see, the width of them are scaled to the magnitude of the number of men in any given flow. If you look at sort of the vertical columns, what we have there, we have men categorized for each event, whether they experience that event earlier than is typical in that country, a typical timing, or later than is typical. And I've repeated the median ages from the previous slide at the bottom of this for your reference. So we can look, if you look at sort of the left-hand column, if you will, the blue bar is the widest, which indicates that the majority of men, 60% in Nepal, experience first sex at a typical timing. However, if you look at the middle column, first marriage, or the right-hand column, which is birth of the first child, we see that there's more diversity, there's a more even distribution of the timing categories. Now, the findings were particularly country specific at this point. They did not align either with region or with typology. However, there were a few features of these Sankey diagrams that were common across all of the countries. One of them, the first, is that there is some degree of path dependence evident, such that if men begin their trajectory earlier than is typical, there's a tendency to stay in that earlier trajectory for the timing of subsequent events. And this is particularly evident for men who begin later than is typical. So while 18% of men experience first sex at a time that is later than is typical, 17% go on to also experience their first marriage and the birth of their first child at a time that is later than is typical. We see very few, very small lines extending from that orange flow up to the blue or green boxes at subsequent events. This is a little bit different for men who begin this particular trajectory with a typical timing of first sex. So while 60% of men experience typically timed first sex, only 26% of them follow the specific trajectory that includes typically timed first marriage and birth of their first child. There's more diversity in terms of the trajectories that they take from that starting point. So I will conclude there and pass it back to Jeff.
Thank you, Kerry. Next slide, please. So just very quickly, some implications in terms of thinking about our programming. I think first is clearly the need to really understand the social context for decisions and behavior, which are obviously in the example that Kerry have given, very different in places with a lot of premarital sex and places where sex almost exclusively takes place within marriage. And think about what the implications are, not just of broad norms, but of the gender norms in particular. This will help both target effective interventions that help men and boys meet the social expectations at specific points in time and prepare them for future life course stages. For example, messaging emphasizing the economic costs of childbearing or the economic costs of having many children may be more impactful in life course stages where men are already expected to be performing the roles of family provider and taking care of economic matters within the household than, say, in adolescence. But need to keep in mind that these things link together, and long-term change is really going to involve shifting these expectations that are attached to masculinity and femininity, particularly around sex and reproduction. I think also some transition points offer particular opportunities for interventions. For example, the transition to parenthood is often a confusing time with a lot of other changes going on for young men and couples, meaning they may be more open to information and guidance at that point. And in particular, thinking about family formation, family planning, other pieces, linking those more clearly together. Finally, I think intervening early is really important. The issues of path dependence that Kerry pointed out, where we can shift that direction of the pathway, change the linkages between these events in some ways, change the timing of things are really important. So understanding that starting earlier can push you into, say, like a later trajectory or a different type of trajectory with different behavioral implications is really important. So overall, I think it's important to remember, one, that context matters, really paying careful attention to norms, especially those around masculinity. Exploring what men's desires, needs, and pressures are is really critical to better understanding this. I think is a major gap in our field at the moment. Programming should also focus more on the social definitions of life course stages and less on chronological age as a defining point for the type of programming that we do. And finally, I think, again, programs need to focus and understand that long-term changes really require that we focus on redefining masculinity and femininity in ways that transform the whole environment in which the life course is taking place and can lead to more equitable processes for both family planning and sexual and reproductive health more broadly. Thank you very much. That's, I think, next slide is the concluding slide. And with our contact information, we'll be happy to discuss this further in the Q&A or via email with anything. Thank you.
Really great stuff, Jeff and Kerry. Thank you so much. And the practical guidance is exactly what we're hoping to hone in on. So thank you, Jeff. Now, with no further ado, over to Alice for the next presentation. Take it away, Alice.
Really nice to be with everyone. My name is Alice and I work with Camber as part of the Breakthrough Action Project. So I'm going to add another concept to the idea of involving men and boys, and this is a concept of gender synchronization. And I'm going to be using some example from Niger. Next slide. So what is gender synchronization? So gender synchronization was basically developed about 10 years ago. And at the time, there were a number of interventions that were gender transformative, focusing on men and boys. And there were a number of interventions that were gender transformative, focusing on women and girls. But basically, what was missing is the idea that both men and women shape and perpetuate kind of gender norms, and that therefore, if we wanted to be truly gender transformative, we would have to work with both men and women together. So that's really the concept of gender synchronization. And the idea is to work with men and women, boys and girls, in an intentional and mutually reinforcing way to challenge restrictive gender norms, catalyze the achievement of gender equality, and improve health. And so concretely, that means considering the needs of both men and women when we are designing programs, and in particular, family planning programs. So it doesn't mean that we have to work with both women and men at the same time. That can be done in a sequence way. And that can also be done through different programs, but the importance is to consider the needs of both men and women. And so there are a number of benefits, holistic approach, in a sense that we are not just considering the woman as, the only one making decision when it comes to family planning, but also kind of long-lasting sustainability, because we are addressing gender imbalance when thinking about family planning. And there are actually as well a number of challenges to gender synchronization intervention. And that applies as well actually for involving men and boys. The first one is conceptual, with the idea that, family planning is a woman's issue. And so it's my body, my choice, and therefore involving men and boy can have negative consequences. The second one is this question of unintended consequences, where we've seen in programs sometimes that are working with men and boys, actually an increase in gender-based violence, because by engaging them on topics like family planning, we are actually reaffirming their authority, and they might be starting making decisions on family planning that they would not normally have made. And then also challenges when it comes to funding and evidence. Funding, because it's often easier to target one specific group rather than two different target groups. And also limited evidence, because there hasn't been, RCT looking at the impact of intervention that involve men and women together versus similar intervention that would just involve men or just involve women. Next slide, please. So why is the concept of gender synchronization so critical? And again, this is adding to the concept of involving men and boys. So gender synchronization is very much about understanding power dynamic within a couple, and it's about making sure there is a mutual understanding between the man and between the woman on specific topics. And so what we found in a survey that was done in Niger, this is data from a cross-sectional survey for both men and women, was that there were a lot of misalignment between men and women on specific topics. So the first one was around kind of decision making. When we were speaking to men, they would say women should have more power, they should be able to make decisions around their bodies and their health. But actually, when you were asking them who is making decision in your house, the man would be making most of the decision, including on women's health. The second thing is around family planning. Family planning in Niger is actually a decision that is made by men and women together. And there is actually a conversation around family planning rather than having one or the other making the decision. The 3 and 4 are around some of these misunderstanding and misalignments. And so what was really interesting is that when we got the data, both men and women wanted large families. But actually, if we were asking to women, would it be a problem if you were pregnant right now? 33% of women would say it would be a problem, and only 8% of men would be, yeah, it would be a problem. So again, kind of misalignment or misunderstanding among men and women. And then the same for family planning, whereby if we were asking women, do you think your husband would accept modern contraception? Only 25% of women would say yes. And when we asked the same question to men, 60% were actually favorable to the use of family planning. So complete kind of discrepancy in terms of what women were thinking and what men were actually saying. And then the last thing that was critical when we're thinking about involving men and boys and gender synchronization is actually partner was the most trusted source of information thinking when talking about family planning. Next slide, please. So key recommendation when it comes to gender synchronization, again, align with some of what we've seen in the do and don't, but very much focus on kind of this question of gender imbalance within a couple. So the first one is about considering the power dynamics before even starting a project. Second is around outreach at multiple levels, community leaders, religious leader, and again, this is to limit some of the unintended consequences that we've seen when sometimes engaging men and boys in question around family planning. Third is around the importance of facilitator, because gender is a difficult topic. Some content kind of recommendation, we heard from implementer that the sequencing was really important, and often starting with a topic that was of interest to the couple was actually a really good way to then have a conversation on family planning, and really ensuring that the content of program foster this mutual understanding of couple expectation. 6 was around combining different approaches. We've discussed it a little bit, but ensuring that you would have group conversation as well as couple discussion, as well as individual discussion to limit unintended consequences, but also to have kind of long-term impact. And lastly, in terms of practicalities, recognizing that sometimes working with men and women is difficult and bringing them in the same place is difficult. And we actually have evidence that programs that have worked with men and women not together also have an impact. And finally, adapting to specific subgroups, reflecting the live courses. So my last slide, next slide, please, is just an example that I think is a good example on men involvement and gender synchronization, where in Niger, UNFPA launched in 2009 husband school, so L'École des Maris, which is targeting husband, and really having conversation around gender-based violence, women empowerment, and family planning. And that was really successful, but actually it's not a gender synchronized intervention because there was no real understanding of women's need and intervention targeting women. And so subsequently, UNFPA actually developed a second project, Future Husband Club and Safe Space, that are 2 programs targeting young people in Niger, 2 different programs. One is targeting boys on the issue of family planning, women empowerment, and then in parallel targeting young girls to discuss the same issue. And so these 2 projects are concurrently happening, and I think are really interesting example of gender synchronized projects. And next slide, which I'm not going to describe, but this is more for information, and we can make that available after. Again, reflecting on the live course and gender synchronization. Camber did a segmentation of women and men in Niger, looking at different segments of the population for men and women, and really developing interventions that are targeting each of the segments. Next slide, and I'm going to end there.
Thank you so much, Alice. This is so useful, and yeah, just really appreciate it. Also just want to inform everyone, as you can see, we're kind of running a little bit behind schedule. This webinar was meant to conclude on the hour. I think we do have permission to extend that a little bit. So just, so you can adjust your expectations and your day. We've had 2 great presentations, 2 more to come, and we still hope to have a little bit of Q&A. It's just that might have to spill over the hour just a little bit. So next up, we're going to have Bethany, if we could move ahead. So over to you, Bethany, take it away.
Great, thank you so much. Hello, everyone. My name is Bethany Arnold, and I'm a technical advisor at Jhpiego. Today, I'm going to share about the USAID Maternal and Child Survival Project's work engaging men and couples in Togo. First off, I would like to acknowledge that this presentation represents the work of many dedicated individuals, including the MCSP team in Togo, the Togolese Department of Maternal and Child Health, and the staff of Breakthrough Research who evaluated our project. Next slide, please. MCSP's work in Togo was built around exploring male involvement in care seeking, including for family planning, antenatal care, and childbirth. This included intentions, motivators, and barriers for their involvement, and understanding views around no scalpel vasectomy. MCSP-led rapid formative assessment in 2016 revealed low male engagement in reproductive, maternal, newborn, and child health, or RMNCH. Common themes included the perception that family planning is only for women, a lack of method availability for men, services not meeting men where they are, i.e. not at hours or locations convenient to their schedules, a perceived lack of male providers offering care for men, lack of communication among couples, and social norms around family planning. From that assessment, we focused on improving communication within the couples and couples counseling during an 18-month intervention engaging married men and couples with children. Next slide, please. So MCSP's work centered on promoting couple communication to engage men around the Clodo Health District. MCSP tested 3 different approaches as a proof of concept to engage men in RMNCH by promoting couples communication, often building upon existing work already being done in Togo. So the first approach was group-based couples discussion, which involved community health workers, or CHWs, delivering a series of 4 discussion sessions with mixed and same-sex groups. The sessions featured 5 digital videos developed under the Jhpiego project with guided reflection. The second approach was home-based couples counseling. MCSP for this approach trained 12 CHWs who delivered counseling sessions at home, either for the couple or individually, as preferred. CHWs used MCSP developed communication and counseling materials promoting male engagement to structure the counseling conversations. The final approach centered around the engagement of an already formed École de Mari, or husband school, with 11 members of the community who had already been trained on gender-based violence prevention. MCSP worked with them on family planning, couples communication, positive masculinity. Each member of the husband school was a positive deviant in their community, mentoring 5 other men each to practice positive masculinity, couple communication, and more. The project also extended no scalpel vasectomy services, trained providers in CHWs across all areas in couples communication, and linked couples interested in family planning to facilities for care. Next slide, please. So as you can see, regardless of the approach, whether it was group-based discussions, home-based counseling, or the husband school, all couple communication activities focused around these themes, including effective communication techniques, male partners accompanying female partners for care, sharing of household tasks, gender awareness, and positive masculinity. Next slide, please. So as mentioned, the intervention was considered a proof of concept test to test out the 3 couple communication approaches. MCSP partnered with Breakthrough Research to evaluate and document this work, some of which is included in the following slides. Overall findings showed enhanced men's awareness, knowledge, and support for their partner's sexual and reproductive health needs, while also revealing misperceptions of fertility intentions, a number of children, as well as differentials in decision-making power around family planning and child health. The quotes on the slide from a married couple highlight these differences in fertility intentions. Next slide, please. So while the intervention was overall small, several changes were noticed. Evaluation and testimonial findings highlighted that men were eager, curious, and interested to learn about RMNCH. Men shared that improving their relationship and feeling closer to their partner was something they valued. Anecdotally, some men even shared that their sex life improved after participating in the discussion groups, likely from improvements in the relationship and communication. Providers and CHWs observed some changes in couples within the community around family planning and couple communication. Several providers and CHWs said that they noticed more husbands accompanying their wives to health centers for care, that husbands were more engaged in their children's health, and an overall increase in demand for family planning among couples. They also heard that couples fought less. Men further shared personal stories of helping their wives with household chores, from cleaning to childcare and cooking, which they were quite proud of. Next slide, please. So our project focused on middle adulthood males, those in couples and with children already. However, it is important that interventions targeting men around RMNCH engagement, gender norms, and other topics begin earlier in the life course for greater potential impact. Overall, couples spoke of sharing tasks and having open discussions, and modeled these behaviors for older and younger children, including around discussing the use of family planning. However, if couples want to have more positive interactions, including with their children, there may be a need for additional modeling, training, or skill development, including around communication skills earlier rather than later. Related, local youth groups expressed interest to participate and learn more about RMNCH, positive male engagement, and gender transformative activities to improve their own current and future relationships and family formation. In addition to intervening earlier in a man's life course, breakthrough research findings pointed to a discrepancy between women's and men's desires and needs for family planning, suggesting that couple counseling should intervene early in a couple's relationship to help the couple achieve its joint fertility preferences and help them jointly decide their family planning needs. Breakthrough research findings also revealed that couples could be reached individually, as couples, or in group settings, making it a flexible intervention approach. As a result, these approaches could potentially be integrated into a number of future RMNCH interventions. CHWs relied on improvisation and creativity at certain points during the project to ensure that the counseling sessions were as useful as possible to participating couples and adapting male engagement approaches to the couple's circumstances. Providers and CHWs also adapted the group-based couple discussion as well. In contexts where men may dominate the conversation and potentially the counseling, or where women may be uncomfortable voicing their opinions in front of men, CHWs and providers can adapt same-sex and mixed-sex sessions as appropriate. Additionally, participants asked for the intervention to be expanded to include additional topics, such as how to parent teenagers, overall communication, and interventions targeting adolescents specifically, including around the use of alcohol and other substances. These were areas where they shared that they would like to see more work done and where they were motivated to keep learning. Next slide, please. For some final points, I want to emphasize the need to include a gender lens within any serious effort to scale up family planning interventions. Our findings highlight the importance of raising awareness and training more CHWs in gender awareness to recognize and address power dynamics within the couple during home and group-based couple communication activities. Further, couple counseling sessions must be matched to women's and men's preferences and need with respect to family planning use, care seeking, and their own life stages. Findings suggest that successful couple counseling programs should consider the workload and schedule of both partners while being sensitive to CHW's availability and workload. Because CHWs are based in the community, it may be easier for them than facility-based providers to find opportunities to reach couples within their own daily schedules and those of men and women as well. However, in some circumstances, CHW home visits with the female partner while the male partner was away working brought on suspicion, so more might need to be done to build trust between couples and CHWs. While not discussed in this presentation, MCSP spent significant time engaging with facility providers and CHWs to support their capacity building and comfort level working with couples together, support men interested in vasectomy, and ensure facilities receiving referred couples had the full family planning method mix, including long-acting reversible contraceptives, to help ensure the supply was available for the demand. So as already alluded to, couple communication and male engagement activities have values as a potential add-on work. Our work in Togo was funded with a small amount of funding as a proof of concept and showed that for a relatively low cost, engaging men in care seeking and promoting couple communication around family planning and RMNCH was generally acceptable and could easily be added onto other interventions or adapted to target different stages in the life course pretty easily. Next slide, please. And so just in conclusion, thank you so much for your time today. More information on our work in Togo can be found on the MCSP website, and I can put in the link as well.
Really appreciate it. Thank you so much, Bethany. And now for our final presentation before Q&A, I'm going to hand it over to Ruchita. So please take it away.
Thanks, Brian. Hi, everyone. My name is Ruchita Pillai. I'm a monitoring and evaluation advisor at the Johns Hopkins Center for Communications program. I'm going to be presenting on just one of Breakthrough Action Zambia's innovative programs, how the project reduced stigma and improved access with integrated health wellness days for adolescents and men in Zambia. Next slide, please. Breakthrough Action Zambia was an integrated social and behavior change project designed to support increased adoption and maintenance of healthy behaviors among Zambian individuals, families, and communities. The health areas included HIV, family planning, maternal and child health, malaria, and nutrition. We had 4 priority provinces in Zambia and 8 priority districts. Within these districts, the project focused on 16 health catchment areas, and then expanded to 35 during the scale up. Next slide, please. The project applied the SBC flowchart, which was designed under the Breakthrough Action Project as a whole. We employed various evidence-based methodologies, including human-centered design, social and behavioral science, qualitative research, as well as literature reviews to gather evidence and the Zambian context around the priority health areas. Those evidence and insights were used to design 8 prototypes, and these were user tested for potential interventions. Out of those, 4 prototypes were finalized, and all of the interventions were then monitored, and data from those were used to adaptively manage the programs throughout the course of the project. Next slide, please. Starting with the formative research that informed the programs, the project recognized adolescents 15 to 19 years as a critical juncture. About 11% of men reported their first sexual intercourse by age 15, and that number went up to 32% by age 18. Adolescent birth rate is one of the highest in the world for Zambia, 141 per 1,000 births, with more than half of the premarital fertility coming from adolescents giving birth. Early in child marriage is pretty common in Zambia. Sex education programs are reported to create harmful gender dynamics with concepts such as don't trust boys, asking girls to dress modestly, and to behave while promoting boys to use condoms. Adolescents also reported the lack of access to appropriate sexual and reproductive health information, resources, and services. Adolescents in general viewed male partners to be the decision maker on condom use, but then unwanted pregnancy was seen as the responsibility of the female partner. Condoms were generally viewed separately from family planning. Condoms seen as used to prevent HIV, whereas family planning was specifically for child spacing. HIV testing and family planning services for unmarried people in general was highly stigmatized in Zambia, often associated with promiscuity, transactional sex, and sex with married partners for adolescents. Starting at adolescence, men experience a lot of shifting roles that affect their health, and this continues throughout their life course. As we heard from other presenters, the role of men as providers for their family was found to be prominent in Zambia as well. But in general, for men 20 to 55 years, the norm and perception was that health facilities are for women and children. Men reported low care seeking, including for HIV testing. Condom use at last sex remained low, including low consistent condom use, even with multiple partners. HIV testing and family planning services, again, highly stigmatized and associated with transactional sex, extramarital relationships, and infidelity for men. Men also reported not disclosing HIV positive status for fear of stigma and isolation from partners, and also reported not getting tested in the first place to avoid having to deal with the consequences of a positive result. Men also reported not discussing health and health-related issues with their peers, and reported lack of forums that foster such discussion. Next slide, please. For health facilities, we found that in general, boys and men reported only visiting health facilities when they are ill, not for preventative services. They also reported lack of privacy around family planning and HIV services. These services were provided on specific days that was known to the whole community, so they would know what they were going in for. And areas within the facilities were clearly marked or known for provision of these services. In addition, men and boys reported negative attitudes of providers. Adolescents often reported feeling unfairly judged, questioned, and sometimes even scolded by the providers. Both men and boys reported concerns over privacy and confidentiality at the health facility, and this also resonated with our other audiences. They also said that even accessing free condoms at the clinics, they were required to fill out registers with personal information, including their reason for seeking condoms. Providers didn't seem to have any training about providing youth-friendly services, especially around family planning counseling. Providers themselves reported asking unmarried adolescents and young people why they needed contraceptive methods. Providers thought that family planning and condoms will promote promiscuity, premarital sex, extramarital affairs, and even transactional sex within these populations. Even pharmacists within the communities refused to provide condoms to adolescents. Next slide, please. Here we highlight the breakthrough action interventions related to these audiences. We have the Adolescent Wellness Days for 15 to 19, Men's Wellness Days 20 to 55, and these were supported by a confidentiality pledge and agreement for providers to improve the provider-client interaction. All of these were embedded and supported by an overarching national campaign known as the Family Health Campaign, Life is Precious, Take Care of It. Next slide, please. So Adolescent Wellness Days were a monthly dedicated day for health facilities, at health facilities for adolescents. Services included counseling around sexual and reproductive health, family planning, HIV, etc., and included general wellness. The services also included screening and testing for HIV and malaria. And while waiting for their individual consultations with the provider, adolescents also had the opportunities to participate in informative group games and activities facilitated by peer educators and community-based volunteers. Next slide, please. For Men's Wellness Days, again, the same idea of a monthly dedicated day for men 20 to 55 years. During these days, each man received a private consultation in which the providers used a specific toolkit to discuss general health issues, including reproductive health, HIV, as well as general wellness checks, which included blood pressure and sugar for men. The consultation also included screening and testing for HIV and malaria, and men who were fathers of under 5 children also received counseling on how they can support children's nutrition and wellness. During these sessions, men also had the opportunity to ask any health and wellness related questions that they may have. Next slide, please. So what happened as a result, these are data from the 4 provinces for the Adolescent Wellness Days. The project conducted 130 rounds of Adolescent Wellness Days between April 2019 and March 2020, so just about a year, and had 12,600 adolescents attend in total, of which 6,500 were male adolescents and 6,000 were female. On average, 96 adolescents attended a single wellness day. Out of those, 4,000 received HIV testing and counseling, and 37 were newly tested HIV positive. 5,000 received family planning counseling sessions, and resulted in 560 adolescents becoming new users of modern contraceptive methods. Next slide, please. Similarly, for men's wellness days, the programs attracted a large number of clients with an average of 76 men attending a single wellness day. The project conducted 136 men's wellness days and reached 10,400 men over the course of the project. Of those, 4,400 men were tested for HIV, and we found 105 that reported to have been tested newly positive. In addition, 5,100 men also were counseled on various methods of family planning. Next slide, please. These interventions were supported by various SBC materials, including a comic book for adolescents that discuss these health issues. In addition to SBC materials, we had radio spots, community events, and even social media groups that highlighted these messages to our priority audiences. Next slide, please. So what happened as a result of this? For key outcomes for adolescent wellness days, we saw that adolescents felt more comfortable. They had more confidence and openness in demanding these health services around HIV and family planning. The youth-friendly services and improved youth-friendly services and improved treatment of youth clients by health facility staff was one of the other outcomes. Both providers and adolescents are now addressing sensitive topics and asking questions around things such as consent and sexual assault. Adolescents also reported or providers reported that the adolescents that were coming into the wellness days were more knowledgeable and proactive about their health and healthcare needs and what they wanted to get out of their visit. It was also reported that the patient and health facility staff satisfaction with these integrated services was pretty high. It afforded them a one-stop shop and also provided adolescents with a diversity of health as well as non-health professionals and increased comfort in seeking these services. Next slide, please. So key outcomes for men's wellness days: the exclusive men-only nature of the wellness days attracted men to visit health facilities even when they were not sick. Some men attributed their willingness to attend the wellness days to the commitment made by providers to uphold the privacy and confidentiality during these events. The supplementary SBCC materials helped clarify misconceptions of services provided. Men also were encouraged to attend wellness days for their own health as well as their family's health and well-being. Some of the unforeseen results were that men also requested additional services that were not offered during those wellness days, such as dental checks and seeing eye specialists. There were also some services that they were feeling comfortable to ask that were often stigmatized or misunderstood, for example, circumcision, and they wanted those services to be provided on these days. Message diffusion played a huge role with these wellness days and led to more and better prepared clients attending them over time. Next slide, please. So why did this work exactly and attract men and boys to come in large groups to health facilities to seek services? The project reframed health facility visits as wellness checks and focused on preventative care rather than just solely for the treatment of illness. Embedding family planning and HIV into integrated health programming with the hope of removing sensitivity and stigma around the information and care-seeking behaviors at the health facility. The project also recognized the differing health needs at critical junctures in the life course of boys and men, recognizing the beginning of adolescence and sexual activity, the shifting of roles with some starting parenthood as early as in their adolescence and taking on provider roles, refining the provider role to include health for boys and men themselves, as well as partners and influencers of the health of their families. The project ultimately created the enabling environment men and boys needed to seek care through the implementation of the wellness days, focusing on health facilities and providers, addressing men's concerns and distinct needs around privacy and confidentiality, addressing the structural and socio-normative barriers that kept men and boys from visiting health facilities, and positively framing healthy behaviors, including family planning and HIV as a way of taking care of their life and the lives of their families. Along with being an integrated SBC project utilizing various evidence-informing methodologies, the project took an integrated health approach to its 6 health areas rather than a siloed one. If we see men and boys at the center of the socio-ecological model as the priority individuals, the project used evidence-based programming to apply the model in their goals of addressing barriers, improving access, and increasing engagement of men and boys in their own health and the health of their families. Next slide, please. And that's it.
Thank you so much, Ruchita, and thanks everyone for your patience. I think, Ruchita, you get the moderator's special award for already integrating the do's and don'ts right into your presentation. So that was just brilliant to see how you applied the practical guidance so directly. I know and apologize to everyone that we're running a little bit late, and also that you just received a waterfall of information very, very quickly. But please rest assured that the slides as well as the video recording are going to be made available to you. With apologies for running a little bit late. I think we're going to keep anyone on who's able to for another 10 minutes or so that we can be sure to answer the questions that have come through. Now, in the meantime, I've been kind of coordinating with the prior presenters to clue them into some of the questions that have come up. So I think we need to dive right into that right now. And what I'll propose just to the presenters is that we go back to you one by one in turn in the sequence that we heard from you today. And if you could address some of the specific things that came up for you, and also just to note for everyone that a few things were coming up kind of in an overarching way. We've been speaking about life stages and life course analysis here, but I think quite a lot of the examples that we saw were with adult men and working within their partnerships, and kind of even after some of those major family formation events that Kerry presented had happened. So there were comments about, well, what about the boys in the boys and men equation, or how can we be shifting some of these attitudes and patterns earlier on in the life course? So if that prompts any responses for people. And then especially the final few presenters on more programmatic implications, I think there's some real interest around how do your teams assess when it is most appropriate to work with men and women together in a discussion group, with their partner, going through a process simultaneously in the same room. Or when is it more appropriate to do something a little bit synchronized, but where maybe there's a kind of men's only space, a women's only space. So those are reflections I've been prompting to you, as well as some more that came up specifically for your presentation. So I'm going to go to Jeff and Kerry to get us started. Maybe just take a couple minutes and then we'll go through the presenters. So go ahead.
Sure, thank you, Brian. So you had among the questions that you had sent us, I think one of the first one was, how do women's life stage align with men's? And I think generally speaking, if you look at it from a very broad perspective, they're probably reasonably well aligned, in the sense that men and women and boys and girls go through the same broad stages, but the meaning of those stages is very different. And that's part of, and also the issue of timing is also very different. So quite often you'll see the transition to adulthood for women being signified, or that transition is also, the event that signifies that transition being quite different than it is for men. And so when thinking about how they might align, when one's considering, say, like working with married couples, thinking about, oh, sorry, I need to turn on my video too. Hi, everyone. It is important to take into consideration that the timing and sequencing is likely to be a bit different in terms of where those issues, the life course align. And then more fundamentally, though, the meaning that's given to being an adolescent girl or being an adult girl is different, and the expectations are different in many places for men and for women. it's a gendered process, in other words. And I think the next question was about the issues around migration and how that might fit into the life course in Nepal. And Kerry, do you want to take that one?
Sure. Actually, I'm going to take that as an opportunity to answer a couple of different questions. Brian had asked us sort of about any modifications to the do's or don'ts that we might offer. I don't really have any modifications to them so much as an emphasis. And there are a couple of areas that I would emphasize. Starting earlier, certainly, is sort of a key theme that I've been hearing a lot about today and certainly agree with. The other is about the need for more research. And one of the things that I would mention is that it seems that to the extent that we are examining how to engage men to change gender norms, or in the process of changing gender norms, there is still sometimes sort of a residual emphasis on what the implications of those gender norms are for women and women's status, as opposed to necessarily for men themselves. And with regard to migration in Nepal in particular, for instance, we know, again, from women's data, not from men's, that men's migration certainly does influence period measures of fertility, the quantum of fertility, and therefore we would presume the tempo of fertility. What we don't necessarily know is what the notions of masculinity are around migration experiences and different types of migration experiences for men, and how they play into sort of the development of one's sense as an adult man, for instance. And we can presume that that might look different in different contexts, where migration one of the reasons why Nepal male migration has the impact on fertility that it does is because it's not generally not the movement of an intact household, of a couple, and any children that they have, that it implies spousal separation. And so what is the meaning for men's life trajectories if migration includes this spell of labor migration that has spousal separation versus movement together with a partner, and at what points during the life, and sort of untangling what the social meanings are of that, I think, is an important area to look at.
Really agree, Kerry, and thanks for being willing to take that deep question, even though maybe it related to just a specific country a little bit more. I think if we could now move in sequence to Alice, Bethany, and Ruchita, and if you were able, I know we're really pushing for time, but if you're able to speak to some of those implementation questions around how the decisions came about to work with men and women together versus separately, and some of the specific questions that I sent you. And if you could keep it to just a couple minutes each. I know it's incredibly hard, but thanks so much.
Thanks, Brian. So I think I've answered most questions on the chat. The only one I would answer here is the question on what's the best approach, whether you should be doing couple discussion, one-to-one discussion versus village group. So what we've seen in most of the example is actually having multiple approaches implemented at the same time is what is driving actually impact. And this is because men and women want different things. So men needs to be in village group so that they can see that other men are in the conversation and making the same decision as they are. And women like to have a one-to-one conversation because, that's where they can express their feeling, for instance, and they don't like speaking, not so much in public. So that's what, some of the feedback we got. It's not always possible, unfortunately. And so for young people in particular, it's really hard to actually have the conversation with the two of them in the same moment. And we have instances where programs that have, as I said, that have been implemented in parallel have actually worked. The main thing is about understanding who is your audience and what is kind of the power dynamic in the target areas that you're working on to see what would be most appropriate. And I'm going to stop there.
Just to chime in, I totally agree with what Alice said. There are different preferences between men and women, between group and individual conversations. And I think I can put in the chat the breakthrough research evaluation of some of our interventions highlighted that, where men preferred being in groups because they saw other couples that were having some of the same issues, versus other times where women preferred individual or group. You know, there's lots of different dynamics, and it really is very context specific and what is appropriate in context. I did want to answer Jill's question regarding what if couples do not reach consensus, kind of what are the next steps? I'm not sure if she's still on, but I really wanted to highlight that couples communication is not a one-time or one-off discussion, whether it's group, couple-based, or individual, but that really requires continual discussion, open communication, and this is a skill that couples have to practice together a lot to unpack their goals, perceptions, preferences, and barriers, whether it's for family planning, fertility, intention, family size, whatever topic. And this is also important whether the couple communication is facilitated by a community health worker, health provider, other trusted community member, or just among the couple themselves. Really, the hope is that initiating these discussions earlier in the relationship or earlier in the life stage, building these skills will help keep these discussions open, and they can be maintained over as the relationship goes. You know, we really know that couples are motivated to improve their relationships, which is something that shouldn't just be overlooked as like, oh, they can't reach consensus. So it's a continual process.
Thanks. And then Ruchita?
Yeah, thanks. I feel like most people have covered the main points, but I would just like to say, in terms of occupying spaces, especially for Adolescent Wellness Days, we had both boys and girls there together. I think there is some value in having such spaces where they're seeking services around family planning and HIV together to shift some of those very rigid norms around who's responsible for family planning, who gets the counseling, who should have access. And in terms of whether or not it should always be together, I would say data should definitely inform that. It is HIV, family planning, gender itself is a sensitive topic in a lot of contexts, even in our context. So it is important to understand the evidence around that and what topics may actually be relevant and important to discuss in groups of men and women together versus separately. In terms of the do's and don'ts, I believe that was one of the questions, is what would you add to the do's and don'ts? And I just want to say it's really one of the big things about gender is being a sensitive topic. It's really tempting for our programming to be gender blind because it creates a neutral space and a neutral approach to health. And sometimes even gender exploitative because certain gender notions are so embedded in the context and pervasive around our audiences, it seems like a quick way to grab their attention and disseminate messages. But I think where we are with gender dynamics and diversity in the world, and evidence supports this, it is really important to seek gender transformative approaches every time, if possible. We shouldn't discount what our messaging and programming can do, especially in this day and age of information, where diffusion is much larger than we expect it to be, and can play a huge role beyond our audiences as well.
Yeah, so agree with that, Ruchita, and thank you for emphasizing that, the importance of really directly addressing these topics, not shying away from the topic of gender or shying away from actually talking about norms of masculinity and the harmful effects they can have on these and other areas. I just really support that, and I think it's one of a few good notes to close on. I also hear, sometimes there's a tension when, of course, funding is always going to be really limited, but there's a kind of tension within these conversations about, okay, we have a life course analysis, so now like which life stage should we like invest in specifically as at the expense of all the others? And I think in the conversation of the life stages, and also in the conversation of groups together or separate or different age groups, the answer is probably yes and to all of them. And probably a concluding advice would be, to invest in early moments of the life stage at each of these transitions, find the ways to speak directly to the stage that boys and men are at throughout the whole course that Jeff put forward in the first presentation, and what synchronized can mean if we have the right kind of moments and spaces for men to have a group that feels really comfortable as men alone, as well as those moments to have important conversations together with their partner, and so on. So yes, and to all of it. Having gone so far over, I just unfortunately need to wrap up the conversation there. Thanks again to the presenters, and Danette, back to you for the final logistics. Thanks.
Wonderful. Thank you so much to all of the presenters, to the attendees as well, and also to our moderator, Brian, today. It's been a pleasure. Clearly, there's so much interest in this topic, and we went over time for good reason. There's a lot more to explore. So thank you so much for sticking with us. Before we close, we'd like to share some additional resources and information with you all. So on the slide now, you're seeing some guidance. It's a guidance document published by the High Impact Practices in Family Planning HIPS Partnership. This guidance is around engaging men and boys in family planning. So we encourage you to review this guidance as you continue your work in this area or start delving into this work in this area. Additionally, my colleague Natasha from the Passages Project shared earlier in the chat some information around work that she and others, including Jeff, have been doing around the Male Life Course Framework, which helps to conceptualize men's experiences, challenges, and opportunities across the life course. And Natasha and others are actually in the process of developing some more practical guidance that's going to support program staff in assessing which stage in the life course is addressed by a program, and identifying strategic opportunities to design, implement, and monitor and evaluate programs that are more effective. So please stay tuned for updates from the Passages Project. And I also wanted to share with you all, next slide, please, that we definitely encourage you to share and read the do's and don'ts for engaging men. We encourage you to share and discuss its contents with your organizations and also with your partners to figure out how you might be able to apply this guidance and improve engagement with men and boys in family planning, as well as other health areas and also in integrated health programming. And I'll be sure to drop that link in the chat box again for you all. And once more, the recording and the slides and the resources will all be shared afterwards. And last but not least, we'd like to remind you all that International Men's Day is coming up on November 19th, and this day represents a really important opportunity to commit or recommit ourselves to challenging and transforming narratives that limit and constrain men and boys in living healthy and fulfilling lives in partnership with their partners, families, and communities. Thank you so much for joining us today, and some of you all have already seen the brief survey on your screen. We encourage you to fill out this survey. It'll help us to inform future webinars, so thank you in advance for participating in that brief survey. Thank you again for your patience, for sticking with us, and we wish you all a great rest of the day wherever you are. Take care.